These headlines are floating around suggesting that erythritol, a low-calorie sweetener, can substantially increase your risk of cardiovascular disease, but I wouldn't be too quick to jump to conclusions. This study looked at circulating erythritol levels in the blood of participants in 3 different cohorts. They found that those with the highest circulating levels had about double the risk of having a major cardiovascular event like a heart attack or a stroke. But that doesn't necessarily mean what you think it does. We actually produce erythritol in our bodies. So it's not clear how much of the erythritol they're measuring in the blood is actually from their diet versus what they're producing themselves. And they measured fasting levels of erythritol, which are less likely to reflect their diet because levels only temporarily rise after you consume it. Although to be fair, if you were to consume a massive amount of erythritol in the ballpark of 15 packets of Truvia in one go, then sure, your levels can remain elevated for about 2 days. But we have no way of knowing how much erythritol they actually consumed because they didn't even consider it or attempt to measure it, nor did they consider other dietary variables. And there's interesting preclinical research suggesting that high blood sugar levels or oxidative stress can actually raise your erythritol levels. So it might be the case that people with underlying health issues have higher erythritol levels and a higher risk of disease, but it's not the erythritol causing the disease. If anything, it's the other way around. So is consuming very high amounts of erythritol damaging to your health? Maybe, I wouldn't rule it out, but this study doesn't come close to settling that. And these headlines are a perfect example of how not to communicate science.